We are fortunate to have Becky McCabe with us. She is the Western Region Emergency Coordinator for Virginia Department of Health, Office of Emergency Preparedness. Becky has over 25 years of state government experience in the areas of emergency preparedness and training coordination, design, and delivery. She is responsible for the regional coordination and support of preparedness and response activities for 8 health districts in the Western half of the Commonwealth. As a certified Virginia Department of Emergency Management VEDM instructor, Ms. McCabe has taught National Incident Management System, Basic Incident Command, and ICS 300 and 400 classes for hundreds of participants since 2004. Ms. McCabe designed the NIMS and ICS in a Nutshell series of courses based on training needs of VDH staff and volunteers. She has worked closely with MRC volunteers and units by coordinating and teaching classes and facilitating strategic planning with MRC units in the Western region. So this evening, we're very fortunate to have Ms. McCabe join us, and I turn it over to her.
Thanks, Adrenia. Can you hear me okay?
Yes, we hear you fine.
Great, thank you. Thanks for that nice introduction. Hello, everyone. It's great to be with you this evening. And as you can probably tell from the introduction, this is a topic near and dear to my heart. In addition to NIMS and ICS, I absolutely love working with Medical Reserve Corps volunteers, and I just want to thank you before we get started for all that you do for the Commonwealth. Or if you haven't started yet, welcome aboard. This topic is an interesting one, and I'm going to pledge to you to make it as interesting as possible. I think what I find most interesting about Incident Command and the National Incident Management System is that when it's used effectively, it can save lives, and there's nothing more interesting and exciting than that. So I'll leave it there, and we'll jump right in and get started with the objectives. We have a few objectives, and due to the magic of technology, Adrenia is in Richmond, and I am in Patrick County on top of a mountain. So we're about four hours away from each other. And so she's going to run the slides, and I'll do the audio portion. So the first objective is that we'll look at the 3 primary purposes of Incident Command System, or ICS, and we'll talk about the benefits of using ICS, as well as the purpose of the National Incident Management System, or NIMS. Next slide. We'll also look at the basic features of ICS, benefits of using it, and the difference between NIMS and ICS. Oh, and there's one more thing. Next slide. In addition to all of that, we'll look at how NIMS and ICS discussions can be filled with TLAs. And TLAs are, here's where we have a drum roll, 3-letter acronyms. As you know, from whatever occupation you may come to this session from, your job, your career, life in general is filled with 3-letter acronyms, and emergency management is no exception. So one of the causes of NIMS is to use plain language. We'll try to not have acronyms that are not explained, but if one should pop up, in the course material, or as I'm talking and you don't know what it means, please type in the chat box and ask. And as you're working as a Medical Reserve Corps volunteer, it's always a good idea to know what the acronym is before you go too far down the road. So with that, you have a couple of handouts, as Adrenia mentioned, and we're going to refer to those throughout. If you don't have them in front of you, it's okay. You won't be lost. We'll talk you through it. One we'll use as the incident scenario, and the other is a 5-page handout that you can use for your reference later on. So what is an incident? To give you a little bit of background, back in 2003, this was quite a while ago, President Bush signed Homeland Security Presidential Directive 5, directing the development of NIMS, a National Incident Management System. And that was required, and it still is required, for all state, territorial, tribal, and local personnel who have any emergency assignments at any level of government to adopt. And so it was mandated, funds were attached, so that was the carrot to encourage the adoption across the country. But what happened to precipitate this is 9/11. In 2001, when the horrible tragedy of 9/11 happened, and our response was not as coordinated as it could have been, NIMS came as a result. And we'll talk a lot more about how that works. So an incident, as you can see here, is any occurrence or event, natural or man-made, that requires a response to protect life or property. And that protection of life or property is an important distinction because NIMS, and especially ICS, can be used for incidents and events. So what I like to do is just explain the difference between an incident and an event right off the bat, and then we'll talk in more detail about both. An incident is something unplanned. As you see here, if it's natural or man-made and it requires a response to protect life or property, like a hurricane or a terrorist event, it's not planned. It happens. It's something that we respond to. Whereas an event is something that's planned. I noticed on the roster that many of you are in Northern Virginia. One of your largest planned events, and one that the Medical Reserve Corps works with every time it happens, is the presidential inauguration. That's a planned event. So we'll use those terms meaning either it's planned ahead of time or as an incident it's unplanned. So a bit of history for the next slide. Commonwealth of Virginia adopted the National Incident Management System in November of 2005. And the state coordinator of VDEM, the Virginia Department of Emergency Management, is responsible for the NIMS implementation. And you may notice there was a 2-year gap between when the Homeland Security Presidential Directive was issued by President Bush to the adoption of that by the Commonwealth. It took some states a little bit of time to embrace it, recognize it, and then put it into action. These types of presidential directives don't happen overnight. So what this does is it establishes standardized processes, protocols, and procedures to help all agencies and organizations work together during any type of incident. So on the next slide, what exactly is NIMS? I won't read it to you, but you can see some of the keywords here is consistent, nationwide. It's an approach, and it's what helps us all as government agencies work effectively together to prepare for, prevent, respond to any type of incident, regardless of size or complexity. Now that means that it can be a catastrophe like Hurricane Katrina or September 11, 2001, or it can be something smaller like a tractor-trailer spill on Interstate 95 or I-81. It's an approach to work for any kind of incident, regardless of the cause, size, or complexity. And NIMS requires the use of a common management structure. So it's a nationwide approach, and it requires some structure, and that structure is what's known as ICS. So to help you visualize that and make it more relevant or concrete. On the next slide, we developed an analogy. Hope this analogy works. We've got snow here. In the middle of summer, that picture may not exactly be relevant for you, but if you think of NIMS as the house, and ICS being just one piece of that house, maybe that will help. Maybe consider it the brick of the structure. So on the next slide, you can see that the structure of NIMS, the National Incident Management System, includes these 5 areas: command and management, communications and information management, simply means the software, the hardware, the processes of communication, the preparedness, which is what we're doing now, training, the ongoing maintenance of it, making sure that things are as up-to-date as possible, and the resource management, resources being people and the stuff, the things. So those are the components of NIMS, and as you can see, ICS is just one of those bricks in the whole foundation of the National Incident Management System. So hopefully that'll give you an analogy to provide the framework for moving forward. If you don't get anything else out of tonight's session, it is that NIMS and ICS are not interchangeable terms. They're 2 different things. NIMS is not ICS, and ICS is not NIMS. There might be a quiz question on that later. Okay, so what is the Incident Command System? It's a standardized, on-scene, all-hazard incident management system. It allows you as users, and as a user and a Medical Reserve Corps volunteer, you're a user of the Incident Command System. You can adopt this organizational structure for any kind of incident or event. And we'll talk about that. You have probably used within the past month Incident Command without even knowing that it's Incident Command or calling it that. So it's very flexible, and it's also a proven management system based on successful business practices. On the next slide, we'll see what ICS is designed to do. It meets the needs of incidents of any kind or size, as we've talked about before, and it allows personnel from a variety of agencies to meld rapidly to form a common management structure. In addition to that, on the next slide, see that it also provides logistical and administrative support because it has structure. It's cost-effective because duplication of efforts are avoided. Anytime you're doing something more efficiently and effectively using a system or a structure, you're going to be cost-effective. You can't help it. It's a great outcome. But also, it can save lives, and that's just my added 2 cents for another benefit of using the Incident Command System. Okay, so a little background on the next slide. Thank you, Adrena. It was developed in the 1970s, quite a while ago, and it's an organizational best practice out of the fire service. There were a number of wildfires, actually dozens of wildfires in the 1970s in California, and all kinds of response agencies came to help. And they came from all parts of the country, large fire departments, small fire departments, volunteer firefighters, you name it. And it was clear that people coming with different processes, different communication tools, different codes, they didn't work well together. So the Incident Command System, this structure or best practice, became a necessary process for those firefighters to communicate and fight those wildfires across thousands of acres and hundreds of miles. So we can thank the fire service for developing the incident command system quite a while ago. The next slide, we'll look at how public health uses the incident command system. And fortunately for the first two, we don't have to use it very often. But we did have bioterrorism threats or events in the same year that we had the 2001 September 11th tragedy, and that was with anthrax. So we did not, in public health, have an adopted process like incident command at that time. Since then, we've gotten much better at responding, especially to disease outbreaks, hurricanes, floods, and other events that public health responds to. You may have other examples. The few that came to mind as I was thinking about this for tonight was we recently have responded as a state or a commonwealth to the Zika disease in that response. Also Ebola, and back in 2009 and 2010 we had an H1N1 flu pandemic, and we absolutely used the incident command system in response to that. And most currently we're gearing up to respond to the opioid epidemic, which is a national public health or a state public health emergency, to coordinate efforts between a number of different agencies. So there are lots of examples for when public health uses the incident command system. So let's look at it now that we've talked all about it. We've talked about the history, where it came from, who developed it. And now, what does it look like? So on the next slide, we'll see the 5 management functions. The first is incident command, and that's the commander of the incident and the person that is responsible for the incident. And there are different branches within incident command that you sorry, I was a little bit distracted there, that you can see here. The 4 sections are operations section, planning section, logistics section, and finance and administration section. I see someone chatted that we have civil unrest as another example of a response using incident command, and that's absolutely right. So thank you for posting that. Now, this is not your everyday organizational chart. In fact, when you, whatever profession you're in now currently, or you hope to be in, or perhaps you've retired from, when you work in an incident or a planned event as a Medical Reserve Corps volunteer, you would follow this management structure using ICS, but it's not your day-to-day organizational chart. So let's look at it in more detail. Slide. Each of those sections has a chief, and the first section is the operations chief. The operations chief, I think, is one of the most critical pieces of the incident command structure, or the most critical functions. And that's because they manage all of the incident-related tactical activities. So they're responsible for reporting to the incident commander, for reducing the immediate hazard, saving lives and property, establishing situational control, and finally restoring any normal operations. So that position, I like to think of the operations chief as the boots on the ground. That's the person that's going to manage those tactical activities to resolve the incident. It's a really important position. They report directly to the incident commander, as all of these chiefs do, and they're going to get it done. The planning chief is equally as important, but they're not managing the tactics. They're gathering and disseminating information critical to the incident to keep everyone informed. What they do is they collect, evaluate, and disseminate that incident situation information and intelligence so that the incident commander has everything that he or she needs to make decisions. They prepare status reports, they display or distribute situational information, and prepare documents for what we will describe in more detail in just a moment, a document called the Incident Action Plan, and that helps everyone stay on the same page with what the objectives are that need to be accomplished in the incident. So on the next page, the next slide, the logistics chief. This is the person that gets the stuff. They get the people, the places, and the things to make it happen. Some of the things that they're responsible for are all of the service support requirements needed, the resources from any location to the incident site or to the people that will get it done for the incident. The logistics chief is a critical general staff function, and I may be dating myself here by putting a picture of Radar O'Reilly from MASH 4077, the TV show from quite a while ago, but I think it's still in reruns, so maybe some of you have seen it before. But Radar, with his trusty clipboard there, he could get on the phone and get anything from anywhere at any time. He was the go-to person, and that's who I think of as a logistics chief. Yeah, somebody else likes Radar too. Good, thank you for chiming in there. So even if you didn't see the show back when it was originally aired, you can perhaps appreciate that. So there's also a finance and admin chief, and that's the final general staff section chief, and they manage the on-scene finances and administrative support. Some of their other functions include recording personnel time, maintaining vendor contracts, compensation and claims, conducting overall cost analysis of the incident, and they document. In incidents, it's very important to have documentation because if it isn't documented, it didn't happen in terms of getting reimbursed. So for incidents either locally or statewide that are declared emergencies, if you have a finance and admin chief that's on the ball and can document effectively, your community or the state can get reimbursed for the time and the resources that were used during that incident. If it wasn't documented, you just might be out of luck. Now, you may wonder, well, how does that impact me as an MRC volunteer? That can also count as volunteer hours, or if you happen to be in a position where you're working in a paid, volunteers don't, but if you're working an incident and being paid in another role, that pay or overtime could be impacted. So the finance admin chief is a really important role in an incident. Typically in a public health incident, the finance and administration chief would be the district business manager. For each health district has a business manager or a human resource manager that would serve in that role. If you would like more information about these positions, or to just have a handy checklist The handout that Adrenia sent to you, the 5-page handout, has those positions described in more detail too, pages 1 through 3. So those are the general staff functions. Now let's look at the org chart again on the next slide. And if you will, just pop them all up, Adrenia, thank you. Yeah, so we've talked about the general staff on the bottom with planning, operations, logistics, and finance. There's also a command staff. And as you see from the lines on the page, everyone reports to the incident commander, those 7 positions. The safety officer, the information officer, and the liaison officer are the command staff. And those are extremely important positions for a larger incident. And I'll be very brief on these descriptions because they are in your printed handouts. The safety officer is responsible for the safety of the responders, not the general public, but the people that are responding to the incident. So they make sure that weather is not going to be a factor. They can't control the weather, of course, but they monitor it and report it. If they're on scene and they see safety hazards, they will point those out. They make sure that everyone has documentation for what to do if someone is injured. That would include a Medical Reserve Corps volunteer or any staff member. And they just keep an eye out for safety. The information officer is also called the Public Information Officer, or PIO, and their role is to coordinate public information in order to let the public know what to do in order to prevent any injury or safety issues for the general public, but also what they need to do. Do they need to stay home? Do they need to shelter in place? Do they need to report to a point of dispensing to get medication? Whatever it may be, there are a number of ways that they're going to get that message, either TV, radio, social media, newspapers, and the information officer works with the incident commander to develop consistent messaging. A lot of times for large incidents, you'll have more than one agency working with that incident, and so each of those agencies will have their own public information officer. I know the Department of Health has regional information officers as well as in the central office, and they all get together, coordinate the messages, and develop those messages together so that it's consistent. And then finally, the liaison officer is the 3rd member of the command staff. And that individual, well, they have a lot of different roles, and it really is incident specific, but they serve as the primary incident point of contact for agency representatives. So if people from different agencies come on to a scene of an incident, the liaison officer is going to coordinate those people. That will be their primary point of contact. They establish and coordinate with other agency contacts. They monitor operations to identify any potential inter-organizational problems. They know agencies. They know members of those agencies that may be involved, and they can coordinate them with the incident commander. And they also serve with the information officer to make sure that there's a positive public perception for the response effort. So they're also a primary point of contact for any of the stakeholders regarding that incident that might not be represented on the scene. So they keep that big picture, and they're really important for a large incident to coordinate those pieces. Another important point to make, and this is as good a time as any, is that with your role in the incident command structure, it's important to know how information and communication flows. And it flows in 2 ways. One is formal and one is informal. Just like any other business or any other work setting, when you want something from your supervisor in terms of resources, you ask your supervisor. It's the same in incident command. When you're requesting something, whether it's permission to do something or you need something, you need assistance, you need resources, you're going to ask your supervisor, the person that you're working for in that incident. That's a formal request, and it has to go up through the chain of command. The informal communication, of course, can go across and up and down. So it doesn't mean that when you're involved in an incident on a scene that you can't talk to anyone. It just means that when you're making a request, it should flow through the proper chain of command within the incident command structure. And I'll give you an example of that. Let's say that you're on a scene, you're working at a shelter, and you see that the people at the registration desk where you are stationed to assist, you see that they're thirsty, but they're very busy. So you want to get them some water. You see a case of bottled water in the corner. You happen to know the logistics chief, Marvin, over there, because you serve on the PTA with him and day-to-day life. So you say, hey, Marvin, can I grab that case of water and bring it over to the registration staff? Well, if you don't report through your formal chain of command and incident command to the logistics chief, which you probably wouldn't, you probably would report to the operations section chief, then what have you done? You've made a request for that case of water that may already have a purpose and a destination that doesn't include that registration desk. The incident commander may have a need for that, and in fact, she does. She has that case of water already for law enforcement who's out directing traffic outside to use that case of water. So I know this is a pretty simplistic explanation, but that's the kind of thing that can happen when the communication flows outside of the incident command structure. And it then becomes, even though it's just a ridiculous case of water for crying out loud, it can become a source of confusion because more people are involved in the process than necessarily need to be. All right, so we've looked at that slide, and you've listened to me talk about that quite a bit. So we'll go on to the next slide, and that is that this structure can expand, and it can also contract. It just depends on the size and the scope of the incident. So let's say, for example, that the incident is large and it requires a lot of resources and a lot of staff. You'll see that the planning, operations, logistics, and finance sections have broken down now into either units or branches, divisions, or groups. This is an example for, let's say, Hurricane Katrina or some of the other large national incidents that we've had. It can also be for a large statewide incident. We'll have a unit that works for the planning section or the logistics section. A finance admin section unit might be broken down to be procurement and personnel, for example. So the beauty of incident command is that it can expand or contract according to the size of the incident. It may be that the incident doesn't require a liaison officer or a public information officer. It may not even require a finance or admin chief when it initially starts, but as the incident grows and expands, those positions are added later. So that's really the beauty of this structure. Also, I think now is a good time to say that ICS can be used for everyday events, not just the scary unplanned things that we're talking about now, as in natural disasters or man-made incidents. You could use ICS for planning a wedding, for example. It's June. I bet someone listening to this tonight is planning a wedding. And think about those sections as positions for that wedding planning. I see I have a chat question, and that's a really good question. Are these positions already assigned, or are they assigned at the time of occurrence? And they're really assigned, the structure is in place. In other words, everyone who is responding to an incident has been for years required to know what ICS is. So if you come upon an incident or you are deployed to an incident operations section chief in one part of the state is going to have the same duties that they would have in another part of the state. So we're all consistent with what those positions do, but they may be assigned at the time they happen, or they may be added as the incident expands. So I hope that answers that. Okay, it sounds like my audio is breaking up.
You're clear.
Are you very okay? Thank you. Okay, very good. Thank you. So we're thinking about the wedding example. There's no such thing as a wedding that can happen without a finance chief, right? Well, I suppose there is if they run to the courthouse to get married. But if you're planning a large wedding, you're going to have an incident commander, and you're going to have an operations chief. Somebody's going to do the planning and the logistics. All of these things can be applied to personal events that you might coordinate. Also, health department exercises and flu clinics are planned, and they're implemented using the incident command system. So folks have an idea of how to use incident command during incidents because they've practiced it during planned events or exercises. I know some health districts have staff development training days where they close every department, every health department in the district to the public, and they all go to a common location and get trained on a number of different items throughout a day. Well, they use the incident command structure to plan that day. They have somebody that coordinates the entire thing. That's the incident commander. And then they have a planning chief, operations chief, logistics. And, of course, there's some financial aspects to it, or also some human resource personnel aspects. So you can see how this can be applied to a lot of different things, not just the unplanned responses. So the way I like to think about using incident command is if you have a lot of moving parts and it's not just a one-person task or goal or activity, but it requires some systematic coordination, then it's using ICS. If it doesn't require all of those things, then it may just be a task that someone is doing, and incident command would not necessarily be necessary. All right, on to the next topic, which is the flow of requests for assistance. And this slide actually, you can see it doesn't quite fit its outline there because it was requested by someone who attended one of these classes. Yeah, I just noticed in the chat box the finance administration for a wedding is the bank of mom and dad, and I absolutely agree with that. That's funny. I'm going to steal that. Thank you. So someone in one of our classes a couple of years ago said, well, how do these requests for help flow from local to state? So we plugged that information in, and it seemed to fit right here. So with incident command in mind, and we're not going to spend any time looking at or talking about unified command, which is at the bottom of your screen. But I will say that unified command is simply when it's a large event that requires different agencies working together. That's called unified command. Perfect example is the Zika potential outbreak, where a lot of agencies need to work together to have a common response. We call that the unified command. So during an incident, the local resources are provided locally, and through mutual aid agreements, non-governmental organizations or NGOs like the Red Cross, private sector companies, they provide resources to the local Emergency Operations Center or through the local EOC, Emergency Operations Center, to take care of that. Every incident starts locally and it stays locally and managed locally unless it can't. So private sector really helps out a lot with natural disasters. We have winter storms, and we have private companies like Walmart or Food City providing bottled water or all kinds of other resources. But sometimes those incidents can't be managed locally because there are not enough staff, there are not enough resources, and then that request for help goes up to the state EOC. And at that level, the state EOC, through the Virginia Department of Emergency Management, looks for other help. Could be nearby in a different region, or it could be a neighboring state, or it could be further away where that incident isn't impacting. And then the assistance flows back to the locality. If it can't be handled at the state level, and that would be a pretty large incident. You can keep the Hurricane Katrina catastrophe in your mind there, where there's no way they could handle that locally or at the state level. It had to be a federal assistance situation, and that's when FEMA and other agencies get involved. But the state has to make that request, and that federal assistance is requested by the governor. The governor is the only person that can request federal help, and that's done through a state declaration of emergency. So that's the process for how help happens, and again, every incident starts locally, and then it expands because those resources are not available locally. Let's see the question. I heard that the VDF, Virginia Defense Force, helps. Is that correct? Yes, the Virginia Defense Force can help. I'm not. It again would be incident specific for how that would be needed and requested. And there are a lot of different state resources that can be put into play as they're needed. Very much incident specific. Okay. Question. Other questions? So, time for a quiz. On the next slide, you'll see some questions that we'll talk about. If you feel like interacting, now's your time to just pop an answer into the chat box. Don't feel like you have to. Now have some examples of how ICS is used to manage incidents. Which of the following situations do you think represents another reasonable use of ICS? So this is a yes or no. Next slide. Yes or no? The coordination of a regional drug take-back event for Medical Reserve Corps volunteers. And the answer is yes. This would be an event that could use incident command. It's an event that's large enough so that there are some moving parts and pieces. Typically, there would be an operational section chief that could coordinate the Medical Reserve Corps volunteers for that particular event. There might also be a public information piece and logistics to look at sites and locations and supplies. And again, it's an event, not an incident, but it could still use the incident command structure to coordinate that drug take-back event. Quite possibly the MRC regional unit coordinator, or the MRC unit coordinator, I should say, would be the incident commander for that, and coordinating other folks to provide different aspects of that event. I hope that kind of clarifies. If you said no there, it's okay. There are a number of different ways to look at this. I think the next one will be a better example for the difference that I'm looking for. And the next one is the calculation of total volunteer hours for the month of May 2017. Would this be a way to use incident command? And the no's are blowing up the screen. Very good. No. This is more of a task. One person can do it, and it's not going to require much coordination. They sit down and crunch some numbers. Excellent. Okay, let's look at the next slide. The oversight of volunteer safety for a door-to-door tetanus vaccination effort following a tornado in your region. This actually happened in the western region several years ago. There was a tornado, and our volunteers helped with a door-to-door campaign where nurses went out to provide Tdap, tetanus, diphtheria, and pertussis vaccination to folks because they were going outside and stepping on nails and getting into all kinds of unsafe environments. So yes, good job. The yeses have won that question. And that would probably be a safety officer who reports to the incident commander or a safety section that would fit into the ICS structure there. All right, so the next one, and this is the last one, coordination of supplies, badges, T-shirts, etc. for volunteers at a health screening event for the community. And I see it's about half and half, yes and no. And my response would be, that one would depend. My thought is, if it's a large health screening event for the community and there is an incident command structure to coordinate all of the moving parts for that event, then absolutely yes. This could actually fall under a logistics section where MRC volunteers might help coordinate the supplies used at that health screening event. Or it could be something pretty small and one person is just carrying boxes of badges and T-shirts and that's their job, and it's a task. So if you said yes, you're right. If you said no, I can see why that might not fit incident command. The goal of this is to have you to think about how incident command fits into the system of coordinating all of the moving pieces for a response to an incident or a planned event. In this case, it really does depend. So I threw that in intentionally. Any questions about that or about this section? Okay, good job on the interaction. Thank you for that. It makes it a lot more fun. So next slide, common terminology. We're going to use plain English all the time. That means that our organizational functions, our resource descriptions, our incident facilities, everything will be used with a plain English reference. No acronyms, no jargon. On the next slide, use of plain English means that we're going to use clear text, no radio codes, no incident agency-specific codes, and especially no jargon. I like to use a couple of stories to illustrate how this can be both funny and tragic. So bear with me. I'll start with funny first. I work with a regional public information officer, and his name is Bobby, and he has told this story many times, so he won't mind that if I share it with you. He used to be a public information director for Montgomery County, and they use the acronym PID. So when he started with the health department, he was speaking with a group of nurses, and he said, you know, I used to be a PID, but now I'm a PIO. Well, the room just erupted in laughter, and he didn't quite know what the joke was because he was just trying to get used to the new acronym. All right, so some of you are already laughing, and I can tell you why. I know some nurses are on the webinar tonight, and that's because a PID for nurses means pelvic inflammatory disease, not public information director. So, yep, that use of acronyms didn't work real well, but he had a story that he could tell over the years, and now I've stolen it and I'm telling it. It's just not a good idea to use jargon, especially in an incident. All right, so that's the funny part. The tragic part of using acronyms or codes or jargon happened in Oklahoma City with the Oklahoma City bombing of the Murrah building. This was years ago. I know many of you remember it. Many of the victims were children of the daycare center there that was on the first floor of that building. And what happened is the hospitals in the area surged to capacity pretty quickly because there were so many victims being transported. Well, one of the section chiefs, quite possibly the operations section, was calling to determine where they could send patients. They called one hospital and they said, oh, we're at code blue, meaning from their jargon, code blue meant that they were full. They couldn't take any more patients. So the person making the phone calls said, all right, well, you're code blue. We'll send these patients elsewhere. Well, elsewhere to the other hospital meant a 45-minute further drive. Well, long story short, and you can tell where this is going as well, some patients died because they had a misunderstanding and sent patients that could have gone to that code blue hospital, meaning their ER was not in fact full, but they were okay. They could have handled additional patients. The code meant something different to each person that was on the phone. This happened a lot during the September 11th response. We had different radio codes for police, for fire, for EMS. No one was able to communicate because we just used a lot of jargon. So that's what the National Incident Management System and also our work in ICS tells us. You can save lives and eliminate confusion by just staying away from it altogether. All right, next slide. So ICS is management by objectives, and those objectives are communicated throughout the entire ICS organization through the incident planning process. All of you know what objectives are, and every incident has an objective. An incident can be something as simple as a police officer pulling you over for speeding. You're speeding along, he or she pulls you over, you know what's going to happen, and that police officer knows what's going to happen because he or she has in his or her head the incident plan, the objective for what they want to accomplish. It may not be written down, it's all in their head, but they know what the routine is. And that's an incident action plan and an objective. So on the next slide, you'll see that each incident action plan, whether it's written or not, specifies the incident objectives. In that case, it was to get you off the road because you were a hazard to yourself and others. It states the activities to be completed, to write you a warning or a ticket. It covers a time frame, which is an operational period. And in this traffic stop example, the time frame would be immediate, and it may be oral or written. The incident action plan for that particular example is in the officer's head. They've done it millions of times or thousands of times. They know what it is. But this can really be expanded and turned into quite a process for large incidents, as you can imagine. So incident objectives are always going to be SMART. I know you've heard this acronym before. SMART stands for specific, measurable, achievable, realistic, and time-sensitive. If the objective doesn't have all of those components, then it's not a really good incident objective. The folks that are writing those incident objectives for larger incidents, they know how to write them and know what needs to be included so that it can be communicated with everyone. For example, for an outbreak that you may be involved in working or assisting with as a Medical Reserve Corps volunteer, the epidemiologist is going to determine a lot about what those incident objectives are based on the disease and how it's best mitigated. So also regarding the incident action plan, it must have 4 elements, and those are on the next slide. What do we want to do? Who's responsible for doing it? How do we communicate with each other? And what is the procedure if someone is injured? So what we want to do, those are the strategies and tactics for accomplishing the objectives. Those are going to be in that incident action plan. Who's responsible for doing it? Which agency? Not necessarily which person, but which agency and which position. How do we communicate with each other? These action plans can be pretty complicated and have a lot of different forms. FEMA has a ton of forms for each of these, everything you can imagine about an incident. And that communication can be what types of radios will we use? What channels will we be on for communicating with those radios? Will it be email systems or websites? It's all in there. And then what's the procedure if someone is injured? Everyone needs to know who to call or who to notify when there is an injury. And I just saw this firsthand at an active shooter exercise that happened just last week. We started the exercise, but there was a false alarm at the beginning of it. So before we even started, a police officer cut his hand because he was trying to clip one of those zip ties. The zip tie was preventing his gun from shooting because we were in an exercise. He didn't want to fire a live round, so he had his gun zip tied. But we had a false alarm, so in cutting that zip tie, he cut his hand and had to be transported to get stitches. So the incident had a safety plan, and everyone knew what to do to get treatment there. It happens. People fall out from dehydration, have all kinds of sprains and things like that, and the best thing to do if you don't know what the procedure is to notify your supervisor right away. All right. So on the next slide, we're going to look at the incident command system organization. And just know that there isn't any correlation with the administrative structure of your organization or any other agencies or organization and incident command. In other words, we all take off our agency hats and our agency structure before we go into incident command, and we put on our ICS hats. And we can't have both because it would be too confusing. So you may have an organization's uniqueness that helps to avoid the confusion, but you don't have the position titles or structures to provide that confusion. For example, when we go into an incident with public health, let's say it's a diesel fuel spill on an interstate and the diesel fuel is flowing into a stream that feeds into a water treatment plant, and it could potentially impact hundreds of thousands of homes in their drinking water. A lot of different organizations will be involved. You would have the state police involved as the traffic incident, the crash. You would have Department of Health involved because it's affecting possibly the drinking water down the road, Department of Environmental Quality, and other agencies, the Department of Emergency Management. Each of those agencies has a unique mission. Well, they're not discarding their mission or their purpose or what their jobs are, but they are taking off if they're a supervisor or a state police lieutenant or something like that, they're taking off their agency supervisory hats and they're falling into those ICS position hats and structures so that they can answer to each other and work together effectively to mitigate that incident. So if someone serves as a chief every day, they're not going to be a chief necessarily when they're deployed under an ICS structure. All right, so on the next slide, we'll talk about span of control. So that means the number of individuals or resources that one supervisor can effectively manage during an incident. And it's really the key to effective and efficient incident management. Some of you on this webinar are, in fact, leaders or supervisors. So you know what your effective span of control is. In other words, if you're supervising a whole slew of people, it's hard. If you can imagine having to make decisions under pressure, how hard it would be. The span of control is a certain number. Any guesses as to what that number might be? The ideal number of people to supervise effectively. Got some 5s, 3 to 5, 20. I can tell you 20 is wrong. Hey, great guesses. Go ahead and switch to the next slide, Adriana. It's between 3 and 7, with the optimum number being 5. Yeah, depending on the size of the event or what the event is, you're right. So ideally, we can supervise effectively between 3 and 7, with 5 being the ideal number. And that's just based on a lot of best practice management experience over the years. So a few ICS nuggets. On the next slide, this is kind of our summary here. The incident commander has the overall responsibility of the incident. That's the person, as Harry Truman used to say, the buck stops here with that individual. Standard terminology is used to help reduce confusion between the incident command structure and your day-to-day positions. Span of control is optimally 5, but it could be as few as 3 or as many as 7. The incident action plan establishes the overall objectives, strategies, and tactics for that incident. All right, ready for another quiz? Let's do it. This one's called Your Best Guess. Feel free to type in the chat box. Which incident command position is responsible for all incident activities, including the development of strategies and tactics and the ordering and releasing of resources? It's the incident commander. Yes, incident commander. Next slide. Now I can see why you would say perhaps logistics, because we threw in the term ordering and release of resources. But what that means is requesting people to come in and serve on the incident or releasing them when the incident is finished. So I can see why you would say that, but it is the incident commander. That's where all that responsibility lies. So on the next one, as a volunteer, which section chief would you likely work under during an incident? Would it be logistics, planning, or operations? This is just your best guess because we haven't talked about it in great detail. Yes, C, operations. Good job. All right. Now we're ready for the scenario. So on the next slide, this is a scenario using the incident command system in public health. It's a tuberculosis outbreak in the fictional town of Mountain View, Virginia. And if you'd like to follow along, or actually what I'd like to do instead of reading it to you is to give you a moment to just scan over the scenario if you haven't already, and then I'll come back in just about 2 minutes and hit the highlights, and we'll go from there. All right, so hitting the highlights. These things always, and I will repeat, always happen late on a Friday afternoon. Not sure why, it's just the nature of it. Of course, that's a joke, but anyone that has been in the business for a while would say, yeah, you know, it does seem to happen, especially on a holiday weekend. But that's when the call came in. The epidemiologist knew it was going to be challenging, and she had no idea. This is based on an actual incident that happened a number of years ago. So the female hospital healthcare worker was diagnosed with pulmonary tuberculosis. She did end up dying of the tuberculosis, and the individual worked in the local hospital system for many years. She potentially exposed over 1,000 patients. Now, Mountain View is a thriving little community, lots of parks. Tourism is the main economy, tourism and moonshine stills. And when the epidemiologist hung up the phone, the health department staff went into action immediately. The decision was made that they needed to screen all of the close contacts for tuberculosis infection or active disease. So a screening clinic was scheduled for March 26th. That's only 8 days after this incident. The incident command system was put into place, and the local health director became the incident commander. An emergency operations center was established at the hospital, and fortunately, a large community exercise had just happened a couple of months prior. So these relationships were already in place between these different agencies, but that exercise just kind of reminded everyone of what to do and how to do it, and it also firmed up those relationships. And you see the list of some of the players: the health director, nurse manager, business manager, and all of the others that you would expect to respond to the incident. NIMS, because NIMS and ICS was adopted, the span of control was about 5 employees. Public information, as you can imagine, became critical very early. Thank you, social media. Rumors started, scared parents. They took their kids out of school. The media did work closely with the public information officer so that they could get a handle on those rumors and get accurate information out. And a Joint Information Center, or JIC, was established really early to help coordinate those different public information entities. So all of the messages that needed to go out to the public, they were all coordinated between those different PIOs, and the incident commander reviewed them and approved them before they were released to the media. This is standard. This is going to be the way it would roll out. The health director would need to have an idea of what was being said to the public before it either made things worse or fed into those rumors. Overall, after some long days and a lot of coordination, the response was a success, and only one case of active TB was found in over 1,200 patients that were screened. And everybody lived happily ever after, as you can see by the remainder of that scenario. And they did an after-action review meeting as well as an after-action report. That's standard also, so that people can learn lessons following any kind of incident. All right. So what we're going to do now is ask a couple of questions again to get some interaction, and to just ask you to think a little bit about the scenario and what your role might be in something like this. So for the next slide, what functions or activities do you see for MRC volunteers to support this incident response? That would mean, how do you see that an MRC response might assist? Yeah, operations, registering at screening, work a call center. Yep, that's a good one. Door-to-door education, sure. Community education, yeah, because the rumor control needs to happen, and public information could do a piece, community education, mental health support. The answers are varied, and they also really depend on those MRC volunteers' skill levels. You all have a huge variety of skills and talents that can be used in a variety of ways. It could be something that if you're very organized or you like working with the public, you could assist at registration, greeting patients, It may be that you have a law enforcement background and you could work in directing traffic to the clinic, so working outside before people get into the facility. It's really a varied role that you could play. It would be an important one, though, regardless. So it would most likely be through operations. So on the next slide, which general staff position might the district nurse manager serve in during this outbreak? Yep, operations chief. All right, good job. Final question. I'll move this along here because it's already 7:17. During your shift while working this incident, you notice that a critical supply is running low and about to run out. Who would you report this to? You said supervisor or your section chief. You got it right. Most likely, you are not going to be reporting directly to the incident commander because there are those section chiefs that would be supervising over those functions. So, good job. Overall, I think you have the hang of this. All right. Any other questions regarding anything we've covered so far before we go to the absolute last question that I'll ask you? Covered a lot of material in this past hour and 18 minutes. All right. Seeing none on the chat box, this is your last question. Is this NIMS or ICS? And I'm going to go with Michael's response first. Oh, good job. You're blowing it all up here. It's ICS, not NIMS. Excellent. All right. So that's Incident Command System. It's a system that works within the National Incident Management structure. The National Incident Management System is the broad approach that we all use. All right, very good. So let's go to the wrap-up slide, which is a few things to remember. So we're on the last slide for me. I may have missed a question too, so I'm going to go back to that. All right, remember, you may someday be a non-leader placed into a position of leadership within Incident Command. You can do it. You already have that get-it-done kind of attitude, or you would not be a Medical Reserve Corps volunteer. You also may be a leader placed into a position of non-leadership. Remember, you can't do everything yourself. And finally, try to, not finally, but the last thing here is to apply ICS during your everyday activities to learn the terminology for use during an emergency, so it's a little bit more familiar to you during an emergency. You could, practice with your family. If you are planning a graduation party or something, a family reunion this summer, why not assign your family members some position section chief roles and see how they do, and you can practice being an incident commander. It's just a thought. On the next slide, know what your individual responsibilities will be for all emergencies. So have an idea of what you need to do regardless of the emergency, and also prepare yourself and your family so that you can serve others if you're prepared. If you're worried about what's going on at home, you won't be as able to volunteer or deploy or do something that can help your community. Okay, so a couple of questions. How will you contact the MRC members if cell phone towers are down? Okay, so if there isn't a cell phone signal, there still is a way to activate the Medical Reserve Corps and notify. It's typically done through email, but your Medical Reserve Corps unit coordinator has every way to contact you through your text messaging process or email, landline phone, whatever information you've given your coordinator to put in the system. That's how they will contact you. So there are a number of different ways to do that. That answered that okay. Carrier pigeon? Maybe no. Ham radios. Love ham radios. And yes, they can be used during emergencies, and they are. So that might be a way to do that, to connect. Adrenia sent me a note that I may have missed a question about. Let me scroll back up and see. It was about a hot wash. Hot wash. That's a phrase that definitely needs explanation. A hot wash is not what it sounds like. It's simply a debriefing of the incident or of the event, and it's where everybody gets together. It's also called an after-action review meeting, and they talk about what went well and what could be improved for next time, or what needs to be taken care of and handled right away. So that feedback feeds into the after-action report for everyone to be able to read, document that it happened and how it happened, and what lessons can be learned for later. I hope that helps with that. I'm going to turn it over to Adrenia now to wrap up, but I'd like to say thanks to each of you for your attention, your great participation. I hope that if you use Incident Command for planning that family reunion this August, or whatever event you might have in your personal life, or as a volunteer for your next planned event with the Medical Reserve Corps, that you can see how ICS can benefit not only the effectiveness of that response, but also you personally knowing that you're doing the absolute best job that you can. So thanks, everyone. Really enjoyed spending the evening with you, and I'll turn it back over to you now, Adrenia.